Good afternoon. Thank you for joining me at this press conference this afternoon. I am back in my office after my self-imposed isolation. I'm wearing a mask because I've got staff in here with me. So we're back to work, back to normal. I hope all Nevadans enjoyed a safe and healthy Thanksgiving holiday. I'm glad to provide you all today with an update as we prepare for a COVID-19 vaccine, which we anticipate may be available in the next week or so on a limited basis. Thanks to the development of the vaccines, there is hope on the horizon. As I said earlier in my last press conference, we're closer to the end than we are to the beginning, and there is definitely a light at the end of the tunnel. There's no doubt that these vaccines will play a pivotal role in helping combat this disease, but it will take time to make sure everyone has access to the vaccine. It's critical to remember that federal officials have widely reported that we won't see large-scale vaccination throughout America until the spring. So we need a bridge to get there, to get from now till then. Here in our state, that bridge between today and the day that we have large-scale vaccination must be built by Nevadans. The tools that we have to build that bridge are the same public health measures we've all heard on repeat over the last 9 months. You've heard these before, but I'm going to repeat them for you again. Avoid large gatherings. Limit exposure by working from home and staying home as much as possible. Wash your hands. Wear a mask. That's all we have. Those are the tools that we need to use. I'm going to spend a couple of minutes giving an update on Nevada's current situation 1 week into our statewide pause. Our current status is proof that as of today, our bridge is shaky. We have a lot of work to do, and it will take all of us to recommit ourselves to turning things around before a vaccine is widely available. As many of you know from watching the daily updates, we are not seeing a downward trajectory in any of the metrics that we are tracking. In fact, we continue to experience increases across the board. As of today, 16 of our 17 counties, that's right, 16 out of 17 counties have been flagged for elevated risk of COVID-19 transmission. According to our state health officials, COVID-19 cases in Nevada are growing at a rate twice that of the previous peak that we observed in July. Daily hospitalizations are at an all-time high. The 14-day test positivity rate is the highest we have seen to date. And the number of daily deaths to COVID-19 is on the rise. The wildfire community spread continues to grow out of control. And most concerningly, our numbers do not yet include any surge from the Thanksgiving holiday. Almost every day, we are breaking the previous records. I am concerned as state health officials are concerned. And if that's not enough, I'd like to share the recommendations and input that was sent to us from the White House Task Force this week. We are in a very dangerous, quote, we are in a very dangerous place due to the current extremely high COVID baseline and limited hospital capacity. A further post-Thanksgiving surge will compromise COVID patient care as well as medical care overall. The rate of COVID spread is increasing in Nevada. Engage local leaders to demonstrate the effect growing cases will have on hospitals and overall patient care if Nevadans don't change their behaviors. All states and counties must flatten the curve now in order to sustain health systems both COVID and non-COVID emergencies need. New orders put in place by the governor should result in a rapid decrease in transmission if compliance with those orders are high. To summarize, if directives and mitigation measures were followed over Thanksgiving and continue to be followed, the White House believes we should see a decline. One more time, these are directly from the White House. So if you aren't inclined to believe me, hopefully you'll listen to them. If best practices were not followed over the Thanksgiving holiday, these numbers will no doubt increase. As I mentioned last week, if we do not begin to see a change in our trajectory, And if this crisis continues to get worse, we will be left in the unfortunate position of having to take stronger actions, something I've been desperately trying to avoid in order to balance the economic impacts. But I've been clear since the start, we cannot overwhelm our healthcare system and put countless lives in danger. Again, there's hope on the horizon, but we must strengthen that bridge between now and the day we have wide-scale vaccinations. Back in October, the Nevada Department of Health and Human Services submitted our state playbook for the COVID-19 vaccine planning to the Center for Disease Control and Prevention, referred to as the CDC. Since then, the planning document has been adjusted as the overall vaccine response has continued to develop and to change. While there are still some unknowns, we certainly know more than we did this last time that I spoke about this. We're expecting to have our first allocation of COVID-19 vaccine from the federal government very soon, potentially by the middle of December. This timeline is still being determined by the federal government, and we're still awaiting what Nevada's first allocation of vaccines will be. Once an allocation is sent to Nevada, our state team is ready to take on the allocation and begin redistributing it. I'm proud of this team for maintaining close relationships with our county and tribal partners in the state to ensure that allocations are distributed as quickly as possible with as much support as the state can possibly provide. The tribal nations in Nevada have all elected to receive their allocations directly from the Indian Health Services, which will be separate from the allocations sent to the state overall. This close collaboration and planning is what will help us ensure as smooth a distribution as possible of these brand new vaccines. Nevada, in addition to some of our other Western state partners, joined the COVID-19 Scientific Safety Review Work Group, which is independently reviewing the safety and efficacy of any vaccine approved by the FDA for distribution. The goal of the Western States Safety Coalition is to provide Nevadans with an additional layer of confidence when it comes to the COVID-19 vaccine. This verification process is happening in lockstep with the federal approval agency process and is not anticipated to cause any delay in getting a safe vaccine to the residents in these participating states. The work group has been charged with staying abreast of vaccine candidates, trials, evidence of safety and efficacy, and other information to independently provide recommendations to state leadership and vaccine planning efforts, as well as to ensure the public confidence in vaccine safety, efficacy, and implementation efforts. It is natural for the public to have questions about a new vaccine, and I remain committed to transparency regarding vaccine planning and expectations. Today, I am joined again by two of our experts on the vaccine planning team. Candace McDaniel, Health Bureau Chief, Bureau of Child, Family, and Community Wellness, Division of Public and Behavioral Health. And Shannon Bennett, Immunization Program Manager, Division of Public and Behavioral Health. They will provide an update to the state's effort as we prepare for the distribution and administration of a safe vaccine as supplies become available. With that, I will now turn it over to Candace to provide an update on Nevada's vaccination planning efforts. Candace.
Thank you, Governor. We appreciate the opportunity to join you today and provide an update on the COVID-19 vaccine planning and distribution. As you have seen, there are currently 2 vaccines that are offering promising results that have filed for emergency use authorization with the FDA. Pfizer and Moderna are showing an early efficacy of about 95%, which is an in proportionate reduction of disease in the vaccinated group. So a 95% efficacy indicates a 95% reduction in disease occurrence among the vaccinated group, or a 95% reduction in the number of cases you would expect if the group had not been vaccinated. Even with the promising efficacy percentages, a vaccine will not be released for use until it is deemed safe and effective. The FDA Vaccines and Related Biological Products Advisory Committee is set to meet on December 10th. And from there, that point, we anticipate things will move quickly. Staff for the Nevada State Immunization Program are prepared and will be on standby to accept initial shipments and for the redistribution when a vaccine is received. Since our last update, we have continued with our planning and preparation for scenarios we may encounter during the vaccine rollout. From these exercises, we have developed a more comprehensive process for distribution. The Nevada State Immunization Program is receiving regular updates on both vaccines and how they must be shipped, handled, stored, and administered. Each have a very own specific challenges and parameters that we are working with. We told you previously about the ultra cold storage needed for the COVID-19 vaccine. The Pfizer vaccine will require ultra cold storage, but the Moderna vaccine will not. Both vaccines require 2 doses to be administered with a set time frame in between. We continue to work with our partners statewide to share this information, ensure vaccinators are enrolled, and initial orders are submitted. Allocations of the COVID-19 vaccine will be made based on population, and we will use the tiered approach in alignment with the Advisory Committee on Immunization Practices guidance to ensure our frontline medical providers receive the first doses. I will now pass it over to Shannon Bennett to talk about our tiered approach.
Thank you, Candace. Thank you, Governor. As Candace said, Nevada's playbook outlines the tiered populations that will receive the first doses of COVID-19 vaccine. It is important to remember that when a vaccine is approved for use and allocated to individual states, the tiers we developed will outline who is eligible to receive the vaccine. Our framework of priority populations begins with those at the highest risk for contracting COVID-19 and those who we are all depending on to take care of us, our critical infrastructure workforce in hospitals and medical facilities. Tier 1 also includes other medical provider types, correctional facility staff, and law enforcement. Of this first vaccine allocation, a portion will also be set aside for CVS and Walgreens, our pharmacy partners, who will work to vaccinate members of our vulnerable population who work and reside in long-term care facilities. We are working with all Nevada counties to finalize their plans to vaccinate their Tier 1 population. An important consideration when vaccinating medical facility staff is the potential for anticipated side effects. As with other vaccines, a low-grade fever and a sore arm are indication the vaccine is doing its job, but it may impact our medical workforce's ability to do theirs for a short amount of time. As we have planned for vaccine rollout, we are planning with our medical facilities to ensure only a portion of the staff receive the vaccine at one time in order to not create a potential staffing shortage. The COVID-19 vaccines will not be released until they are deemed safe and effective. But these common side effects are an important consideration while we all work to protect the health of our communities. Once a vaccine is approved, we anticipate weekly allocations, and each county will be able to submit their request for the vaccine. These requests and the monitoring of vaccination and distribution will run through Nevada's Immunization Information System, Nevada WebIZ. The Nevada WebIZ system is widely used by Nevada's immunizing providers, and Nevada state law requires that all vaccines given in the state must be entered into the system. This is a system that the immunization program uses every day for influenza vaccine and the Vaccines for Children program. We are able to track how much vaccine has been used and how much is still left on hand. The program is working hard to be prepared to get the vaccine to our immunizing providers once it has been approved. And we are updating Nevada's vaccine playbook with additional details as thoughtfully planned to support this response.
Thank you. I again want to thank Shannon, Candace, and their entire team for their tireless work on this vaccination rollout plan. This rollout is unlike any other, and I am proud of the work they have done to engage with state and local officials to be prepared for this moment. I want to conclude with one more quote from this week's White House report, an important message that must be heard by all Nevadans. The COVID risk to all Americans is at a historic high. It must be made clear that if you are over 65 or have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked due to the immediate risk to your health. You should have your groceries and medications delivered. If you are under 40, you need to assume you became infected during the Thanksgiving period if you gathered beyond your immediate household. Most likely, you will not have symptoms. However, you are dangerous to others and must isolate away from anyone at increased risk for severe disease and get tested immediately. If you are over 65 or have significant medical conditions and you gathered outside of your immediate household, you are at significant risk for serious COVID infection. If you develop any symptoms, you must be tested immediately, as the majority of therapeutics work best in early infection. And before I conclude, I want to mention a few other things. I want to have a special shout out to our frontline healthcare workers, our doctors, our nurses, our technicians, our maintenance folks in the hospitals, everyone that is working in our hospitals and our healthcare facilities, the National Guard that have been instrumental in providing the COVID tests, in providing food from the food banks to various agencies, and in helping us navigate our way through this pandemic. The lab staffers, all the frontline workers, whether they're truck drivers or grocery store workers or restaurant workers that put themselves on the front line serving all of us during this pandemic. And as it relates to the hospital, the field hospital that was built at Renown, the hospital is real. The comments that were made by the President of the United States were not helpful. I have seen the hospital. Patients are being treated in that hospital. And we have our front care health line workers working every day in that hospital to protect people's health, particularly in Washoe and Northern Nevada. At this time, I'll be able to take some questions. I'll turn it over to my staff to coordinate the media questions and question and answer period.
Thank you, Governor. This is Megan Delaney, the comms director. I am just going to make sure I have all the correct folks in the spotlight here, which I do not think I have done correctly. So thank you everyone for a bit of patience. We will use the chat and raise hand function. So if you could raise your hand and then we'll call on you one at a time. Great, we'll go to Sam Metz from the AP as the first raised hand.
Hi, Governor. Thanks for taking my question.
Hi, Sam.
First of all, you sound a lot better, which I'm happy about.
Thank you.
So the original vaccine playbook said the #1 criteria for tiered distribution was level of exposure, but retail workers were ahead of inmates and long-term care facility residents. Can you explain that? And does it have to do with the composition of the economy or the power of interest groups representing labor?
Okay, and I'm going to divert most of the vaccine questions directly to Shannon and Candace since they've been involved in the discussion. So if one of you want to handle that, and then if you want me to jump in, let me know.
I can take that one. We have adjusted our tier structure and we'll be following the Advisory Committee on Immunization Practices as it is released for their recommendations. But we will be releasing a newer version of our playbook that will have adjusted some of those tiered numbers and structure.
Okay.
Thank you, Sam. Sorry about that. We'll go to John Sadler of the Las Vegas Sun for the next question. John?
Hi, Governor. How are you?
Good, John. Thank you. Appreciate it.
Yeah, I was wondering, do we have a timeline on when we may be able to get into tier 2? I know we're very early in this, but when would somebody outside of these populations in the first tier be able to maybe?
Well, I'll let Shannon and Candace take that one too. Unfortunately, we don't know the size of tier 1 yet. So it's going to depend how many doses we're going to need to get through tier 1. But Shannon or Candace, go ahead.
Yeah.
Yeah, Governor, I think you are correct. We have to wait on our final allocation numbers to get us through December, and then we'll be able to know more about how quickly we're moving through that tiered process.
Megan?
Thanks for the question. We'll go to Megan Messerly from the Nevada Independent for the next question. Megan?
Thanks so much for doing this, Governor, and echoing Sam's comments. Glad that you're feeling better.
Thank you.
So turning away from the vaccination conversation a bit into the rising case numbers, the CDC today again urged Americans not to travel over the holidays. Other states have issued travel advisories, recommended that visitors quarantine upon arrival to their states, or in the case of Hawaii, put in place testing requirements for visitors. So I have two questions related to this. One, is Nevada considering putting any of those policies in place? And two, should tourists wanting to come to Las Vegas in the coming weeks follow the CDC's guidance not to travel over the holidays?
Well, I'm going to reiterate that our resort partners have a very robust mitigation situation in place. They're following all the protocols that we have. They helped develop some of the protocols. The Gaming Control Board has been instrumental in terms of enforcing those. I don't know what we're looking at in the future. I said a week ago that we're going to have to look at everything in 2 weeks, and we're going to do that. But it is not my intent right now to put a travel ban on or any travel restrictions to the state of Nevada. Again, it's a difficult situation. You're walking on the edge of a knife trying to balance the economy and at the same time a healthcare system that is being burdened heavily. So as I said, the good part is that the cavalry is coming. There's hope on the horizon here. We've got 2 vaccines, both of which are going to be delivered in the next few weeks. And we need to get those out into our community and hopefully get them continued supplied on a regular basis, and we get our way through this.
Thank you, Governor. We'll go to Mary Hines of the Review Journal next.
Hi, all. Thank you for taking my question. Can I get some clarity, please, on Tier 1? Shannon, I think you mentioned correctional facility staff are in Tier 1, law enforcement, but the CDC committee put in their Tier 1, as I understood it, just healthcare workers and long-term care facility residents. So in Nevada, who's going to be first in line, very first in line to get the vaccine? And how much of the vaccine do you expect to get? I know you perhaps don't have a precise number, but do you have an estimate?
Thank you for the question. So our healthcare workers and our hospitals will be the very first to receive the vaccine. That's where a lot of our initial efforts have been. Our planning assumption is pro rata allocation based on population.
Thank you, Shannon. We'll go to Sasha from Channel 8 for the next question. Sasha?
Hi, Governor. Thanks for taking my question. I know that Dr. Fauci has spoken about on a national level that in order for a vaccine to be effective, 40 to 50% of the population has to actually receive it. So will there be any regulations at this point, on a state level for healthcare workers or really anybody else in, a public capacity that will be required to take the vaccine at any point in order to keep doing their job in that same capacity?
Yeah, no, we don't plan on putting a restriction in place that mandates anybody receive the vaccine. I don't know what various employers might do as it relates to that. I think if anyone wants to realize, and people do realize the situation that we're in with the pandemic and the restrictions that are in place, and people want to get away from these restrictions in this situation, that they will eagerly await for the vaccine. I think the bigger problem we're going to have is people are going to want to get it as quick as possible, as opposed to not getting it at all. And I want you to remember, and it's extremely important, when Shannon and Candace made mention of the doses that we're going to get this month, that's the first dose that people are going to get. It's going to need to be followed up with a second dose 3 or 4 weeks later, depending on which vaccination it is. So the first dose comes, and then 3 or 4 weeks later, the second dose comes, and hopefully we'll be on our way by that point to protecting the entire population.
Thank you for the question. We'll go to Joe from Fox 5. Joe? Joe, it looks as though you're unmuted, but I can't hear you if you're asking a question.
Okay, can you hear me now?
We can hear you now, Joe.
Okay, thanks. Governor, appreciate the question. Thank you. When do you estimate the general public will be able to get the vaccine once the first groups get it? Would you categorize in days, weeks, or months?
Well, I'm going to let the experts deal with that. But again, we're getting into hypotheticals. We don't know how many doses are going to be in each tranche of the vaccine that we're going to get and how big these tranches are that we're dealing with, the front end, the healthcare workers, public safety, that sort of thing, our convalescent homes. So go ahead, Shannon or Candace, if you can answer that more. Go ahead, please.
Yes, thank you for the question. Our planning assumption at this point in time for the general public and what we can plan on is spring to mid 2021 for the general population.
Thank you for the question. Thank you, Candace, for the answer. We'll go Jerry Davis. This is Reno next.
Thank you. Can you guys hear me?
Yep.
Excellent. I'm not sure this might be a question for Ms. Bennett. So if I'm correct in understanding here, the first doses that will roll out will include law enforcement, but also correctional facility staff. If that's the case, I'm wondering, will people incarcerated in Nevada's prisons also be among those to get first doses? And if not, why not?
We will be looking at vaccinating inmates, I believe, on tier 2. So soon, hopefully, depending on our allocation, but we will be focused in on inmates first, and that is because, the correctional staff first, and that is because the correctional staff move in and out of those facilities to work and then back into the community and can increase spread within that particular system.
Thank you, Shannon. Thank you for the question. We have time for a few more. Ms. Starbuck from KUNR Public Radio.
Hi, I just have a question, I guess, about what you guys are doing to make sure that people do get the vaccine, especially with Nevada having such low immunization rates, and then also making sure that folks come in for their second dose.
Well, and I'm going to turn this from the experts too, but let me say, first off, with the efficacy rates, the flu vaccine is approximately 40 to 50% efficacy. This, we're talking 95%. I mean, if you've known somebody that has suffered or contracted COVID, believe me, people are going to be encouraged and eager to go get the vaccine. What we're going to do is the various entities are going to work with the individuals that were vaccinated, make sure they get the second vaccine. But I think that there's going to be a lot of incentive, I mean, to feel better and to have that protection, so they will come and get the second dose. But Shannon or Candace, go ahead.
Yes, thank you, Governor. Very much agree with that. And what I would say is that, that second dose is really critical. But on top of that, we really truly believe in vaccine confidence, and we are really committed to being transparent and showing this information. And so as we focus on tier 1, we've been very supportive of those individual groups providing information as it comes out at the federal level. And as we move into the general population, that outreach will look different, but we're still committed, along with our partners who are also very much committed to building vaccine confidence.
Thank you, Governor. If it's all right, I have 4 more questions in the queue right now, so we'll move through those and then we'll pull to a close.
Sure.
So we'll go to Terry Russell next. Terry, if you could just unmute your microphone, you can leave your video off and we should be able to hear you properly.
Thank you very much. I'm wondering, the 2 vaccines, actually there's more than 2, but Moderna and Pfizer are 2 different vaccines. Moderna does not require the sub-zero temperature to store. The Pfizer vaccine does. 2 questions. Does the state get an option of which vaccine they will get? And is there concern? I know you guys said you had refrigeration for the other vaccine that needs that real cold storage in order to be effective. Are you concerned? Are you going to push those to the urban areas and leave the others to the rural? Because I'm going to assume it would be very hard to keep the stuff stored in a rural area.
Thank you for the question. It's a great one. So no, we do not get a choice at the federal level. We do not get to pick and choose whether we receive Pfizer or Moderna products. Pfizer, it looks like it's coming first. So we are focused on making sure every single Nevada county has access to that particular vaccine because it's going to be first, and we want to ensure our healthcare workers are protected as soon as possible. Eventually, when we move down the road and we have both of the products in the state, we would like to be able to get Moderna products out of Nevada because it will be easier for them, as you mentioned, to store and handle. But that's not where we are going to be at the beginning, and we will treat it as such.
There are, and that's a great answer from Shannon. There are other differences between the vaccines. For example, the minimum, I think, on the Pfizer vaccine is 975 that could be sent to a location. Moderna is 100. So in some of the smaller areas, we're not going to be able to ship 975 and not have them be used. So the team has done an incredible job working through these differences, these intricacies of the distribution. And it's our goal to get as many vaccines available as we can get and get them out as quickly as we can in the community and assure everybody get that second one at the same time. So go ahead, Megan.
Thank you, Governor. Thank you, Shannon. We'll go to Dana Gentry of the Nevada Current for the next question, and then we'll have two more after Dana.
Hi, Governor. Thank you for taking my question. I'm glad to see you are well. Can you tell me how large the Tier 1 population is? And are you confident enough, given the problems that we've had obtaining all the components for testing, are you confident that you'll receive the subsequent dose allocation, or are you going to have to stockpile that initial allocation and split it, basically?
Okay, I'll let that to Shannon and Candace as well. We are not stockpiling, I can tell you that, and we're confident we're going to get ongoing shipments because that's a commitment we've got from the federal government. But go ahead, Shannon or Candace.
So I think both of us can kind of answer your question for this. What we're really looking at, and as the governor mentioned, is a weekly cadence of allocation. And so with that being said, I think it's important. We really will have a very specific, moderating that particular process. And so we feel really confident in understanding and communicating both with our community need, our county need, as that allocation rolls in. And I'll just hand it over to Shannon.
Thank you, Candace. I'm looking at our playbook right now. We have 173,000 people in Tier 1. The federal government has assured us that for every first dose, we will get a second dose to equal that amount.
Thank you for that. We'll go to Victor Jakes of the RJ, and then Brenna Goff, I believe from Bloomberg, will take the last question. So Victor.
Thank you. Hey, Governor.
Hey,
Yesterday,
Victor, how are you?
Good. I'm glad you're doing well.
Thank you. I appreciate that.
As I'm sure you saw yesterday, the Nevada Hospital Association said that, quote, on and off again closures appear to be building animosity and apathy among the public and are proving ineffective, end quote. Do you agree or disagree with the Hospital Association's assessment?
Well, I don't think that they meant it the way that some people are interpreting that. We've got a great relationship with the Hospital Association, clearly. Yes, people are frustrated with what's happening. I get that. I get that every single day. I mean, we've had everything shut down. We opened it back up. We had to take a step back again. People have, if it's called COVID fatigue, whatever it is, we're doing the best we can, and it's a difficult situation, again, balancing the economic side, and I'm counting the schools as part of the economic side and the well-being side with the strain on our healthcare system. And we're doing the best we can to possibly manage that. I can't say enough about our frontline healthcare workers. I mean, they are out there every day. I talk to folks that have not had a day off in 4, 5, 6, 7 months. I mean, they're working every single day. They're taking extra shifts because they know that we so desperately need the care. But we are working closely with the Hospital Association, and they're on the same page I are. There is no silver bullet to end this. If I could say, look, whatever it was, if you did this procedure, you handled this protocol, it would solve this for sure. That doesn't exist. It's the culmination, it's the summation of a lot of different things, small things that can make a difference. And the vaccine is the most optimistic, beneficial thing that's coming along, and we've got that on the horizon. But we work closely with the Hospital Association, and we'll continue to do so.
Thank you, Governor. Thank you for the question, Victor. We'll do the final question from Brenna.
Hi, thanks for taking my question. I'm wondering, with the initial doses of vaccine that Nevada expects to receive in December, if you could explain a little bit about the types of impacts we could see in the short term from that. You know, is that something we could see affect case numbers or maybe improve case numbers fairly quickly, or is that something we're going to have to wait a while to see the impacts of?
Go ahead, Shannon or Candace, you want to take that? And then I can add some things at the end.
Absolutely. Thank you for the question. I think to understand the dose series is really important to answer your question. And so those two doses are critical. So for the Pfizer vaccine, we're looking at a 21-day minimum interval. For the Moderna, we're looking at a 28-day minimum interval. And it's critical to have both of those doses to get the full immune response.
And the other thing, it doesn't take effect, and Candace or Shannon, correct me here, the day you get the vaccine, immunity does not exist. There's a time lag, I think it's a month after the first one, till that there's some level of immunity that's been provided to you as a result of that. So this is not going to happen like a magical wand getting waved where you go in and you get the vaccine and suddenly you're immune. There's going to be a time involved here, but we're positive that once we get this moving, it'll continue to move and build momentum, and we'll get more and more people involved, and then they'll get the second dose, and more people are going to be included, and we'll get through everybody as quickly as possible.
Thank you for the question, Governor. We will go ahead and pull to a close if you have any closing comments. Thank you, everyone, for joining us. As Shannon and Candace mentioned, we will have an updated copy of the playbook to send to our media partners and the public after we pull this press conference to a close.
I want to thank everybody for joining us, particularly Shannon and Candace for being so helpful in answering so many of the technical questions as it related to the vaccine. But I want to stress to the general public that things are looking a lot better. You know, our numbers haven't been great. I get that. Everybody understands that. But we have hope now. A vaccine is coming. Within weeks, we will begin distributing and giving people needle sticks. I mean, that's a positive thing. This has been done in record time. And it's our hope that we can get as much of this as we can out in the general public. We'll build more and more immunity, and we can start to get back to our regular lives. And it's our hope that all Nevadans, and I think more Nevadans want to get the vaccine than don't, and we're going to have a shortage on that side, not people not wanting to get it. So in the meantime, we need to continue doing everything that we were doing, wearing masks, practicing the social distancing, washing your hands, avoiding large gatherings. Those things all make a difference. That will help us build a bridge stronger to get to the other side where there'll be enough vaccine available for everybody that wants it to get it. And hopefully that'll be sooner rather than later. So thank you for joining me. We appreciate it, and have a great night, everyone.